I've been talking a lot to my patients on social media and Instagram, and certainly they have a lot of questions. Now I have time to answer them. And one of the most important things people ask me a lot is, are you a real plastic surgeon? And how do you find a real plastic surgeon for you? Well, let me tell you how to do that. So what is a real plastic surgeon? A real plastic surgeon is someone who has significant training and who I think will have the expertise to give you some very important information about being safe and being informed. So plastic surgery comes from the word, of Greek origin, to form or to make whole. And of course, we are physicians. We are not godlike. We actually are physicians first before we're plastic surgeons. And certainly in that vein, the eye only sees what the mind knows. It means that we study a long time, become physicians, and even longer to become plastic surgeons. There are many myths about plastic surgery, about who is plastic surgeons and who is not a plastic surgeon. The hype is such that when you do talk about plastic surgery, it can be very, very perplexing and confusing. So what is that hype versus reality? So who is a real plastic surgeon? What are the 10 facts you need to know to be safe? And then the 3 magic questions to be wise. First, plastic surgery comes and can be both reconstructive and cosmetic. Reconstructive means to restore to normal. Cosmetic means to improve the normal. And you see that when you do a reconstructive surgery like breast surgery. And all reconstructive surgery is indeed cosmetic because you want to look and feel normal when you're restoring to normal, such as in patients that have undergone breast reconstruction, like Angelina Jolie, after prophylactic mastectomy, the reconstruction done by a real board-certified plastic surgeon, colleague of mine in California. And a reconstructive surgery, as in this patient that had a significant scalp burn, and we reconstructed this with tissue expanders. And then the facial aesthetic surgery, as this patient that underwent a lift and fill facelift. This is real surgery done by real plastic surgeons. This is also a real facelift patient that has had her eyelids, she has sagging of her eyelids, some jowling, and we did a upper and lower lip blepharoplasty, face and neck lift, and contouring around her lips with a peel. So how about you all?
Yeah, well, I think it's supposed to be like in 14 days in São Paulo, but like Brazil is just like the US, like in how continental it is. So I think it will affect differently each area. So
yeah, I don't think y'all have been hit as hard as the US, have you? Or I don't know.
Yeah, probably. Well, you're testing a lot, so maybe there is somewhere worse that's not like having trustful data or something.
Okay. So,
Yeah.
no,
So
I think, Dallas has been, and Dallas is certainly not like New York. We'll see. We'll see what happens. We'll see the next
couple of
few
weeks or something.
Yes. But
well, firstly, thank you a lot for accepting the invitation to join me.
You bet.
Yeah.
It's my pleasure.
Yeah, so it's always interesting to watch your lectures about surgical techniques and everything. Obviously, you're an expert in facelift, rhinoplasties, but usually in the American meetings, the ASPS or ASAPs, they're usually the moments you talk more about entrepreneurship, leadership, and that's something that I think lacks for us as young surgeons, like to talk about that, and it's not a common topic in Brazilian conferences. Right. So that was the basic idea of this talk, and it was just funny because I invited you just before getting this month's PRS.
The editorial.
Exactly, and it blended just so perfectly. So yeah, I would like you to share some insights about that.
Well, I mean, it's leaders versus role models versus mentors. And I think the big thing is, leaders have the global picture. They have visions. They're respected. They give you the vision for the mentors and the role models. And, you have to be if you're going to be a leader, you have to lead by example, and you have to have the vision. So, hi, Roy.
Hey, Dr. Rory, how are you?
I'm awesome. How's life with you?
Oh, it's very good. Thank you for asking.
Good. Looks like a beautiful day in San Francisco.
It is. It's going to be a gorgeous day, and we'll avoid being in the sunlight and avoid vitamin D as much as possible.
No, but isn't vitamin D supposed to be good?
I think some quantities are good. Of course, it can cause skin cancer and wrinkles, so you have to be judicious in how you get your vitamin D.
But in the age of COVID, I think one of the things that they recommend is, of course, and of course, it's all anecdotal, vitamin C, the lozenges, as well as, of course, vitamin D. But do we really know?
How's Dallas Cosmetic 2020? How did you feel? It's been about just under a month.
Well, I think we just got in under the cusp, as you know, and, it's probably the last meeting for months, probably till the end of the year for all of the United States. And then who knows? I think the new normal is going to be a little different. I think we've learned a lot of things from education, and some of it has actually been good. I mean, just to give you an example, I do weekly calls or daily calls with my fellows and residents during the week, and we have educational conferences, and then we have people join in from New York and my past fellows. So it's actually good. And I think future meetings are always going to have a virtual component from now on. And I think that's what we're definitely going to be doing with Dallas Rhino Cosmetic starting next year. There's a lot of hands-on, and I think that's good. But I think the virtual live component was going to be there as well. And I think that's a good thing coming up, because I think when I see new meetings coming up, and there was just a great meeting called WAPS in South America, that actually was overall quite good. The panels were interactive and live. I think that was good. So I think we're going to be doing that next year for Dallas Rhino and Cosmetic as well. I think it will have a broader reach, because is it really realistic today for people to travel, 13 hours to come to a meeting for 2 days? I don't know. I don't think so. It may. And I think otherwise, I mean, obviously, it's always good to come and people can come visit me, but obviously, I'll have to limit that in the future too. And but it's a new world.